Dr. Salme, you've been in the chiropractic industry for 25 years now. As an expert, I was actually one of the questions I wanted to ask you when people generally, what specific symptoms somebody who doesn't know the chiropractic industry, in other words, the norm would go to a GP. In other words, you have a headache, a head pain. Like, I'm just curious to know, like, what some specific signs and symptoms instead of going to a GP, perhaps a chiropractor like yourself is actually the remedy to the pain, the cause.
Well, so a very good question. I think what a lot of people don't know is that as a chiropractor, you're educated as a primary health contact nutrition. What that actually means is that firstly we're taught to diagnose, but secondly, when a patient comes into our practice or into our reviews as a chiropractor, regardless of what they're presenting with, whatever symptoms they are, we have been educated to assess, examine that patient and say, okay, this is a chiropractic case. You're in the right place. We can treat you for whatever. Or actually, you've got a bit of a problem here. This is a heart condition, lung condition, whatever the story is, and then initiate the appropriate referral. So that's probably the thing that probably needs to sit right at the top is that, if you're suffering with headaches, neck pain, back pain, which is kind of the bread and butter stuff that we see as chiropractors.
Which most people go to GPs. So that's why I'm curious.
Absolutely, it's true. And with due respect, I mean, in terms of what the GP is going to do for you, they'll do a couple of tests and make sure there's no major red flags going on. But their course of action is to give you painkillers or anti-inflammatories. Now, that is an approach. If that works for you and you really don't have time in your day to stop and think about what's going on, to go to take a painkiller or an anti-inflammatory may well get you in a little bit of trouble. It's not going to fix your problem. No, as this is often the issue, is that when you get pain, when your body gets pain or exhibits pain, it's an alarm system going off. It's saying, hey, you need to pay attention here. I'm not coping with what's going on here, and I need you to do something about it. For us to be able to take a painkiller or an anti-inflammatory is a very quick and often simple solution, but we haven't fixed the problem.